Hi guys, welcome back to my channel. My name is Shanae Monique and I'm finally back with a video about my recent surgery that I had with Dr. Altman. I did something completely different than I normally do. Outside of surgery, obviously you guys know I love my surgery, but this time I had surgery under, I think it's local. So the two anesthesias that you go under for surgery are local and general. Let's see, I think it's local anesthesia that I went under, but let me just double check so I'm not giving you guys the wrong information. Let's see, Dr. Altman. Okay, yeah, so it's local anesthesia that I did. General anesthesia is when you get put to sleep and you have an anesthesiologist in there, you have your nurses, you have to do your blood work. It's a lot more risky, I would say, to go under general anesthesia. And then with local anesthesia, you just use a local numbing agent and numb the area, and then you're awake during your whole procedure. So the risks are cut down by a lot. Obviously, I'm not a doctor, nor am I a nurse, nor am I even close to the educational background of either of the two. So I'm just kind of going on the information that I got. And then you can also do your own research and ask questions as well. So the reason why I decided to go under local anesthesia was basically I had liposuction maybe 3 or 4 months or so prior to this procedure, where if you guys follow me on Instagram, you guys know that I did liposuction of the arms and back and waist, and then also with body Tite on my arms. So I was hoping to be done with all my surgeries, but I just had these two stubborn areas, one on each side of my side, waist, whatever you want to call it. I had these stubborn areas that would not go away after that liposuction that just completely bothered me. So I harassed Dr. Altman. Even though he's so sweet and kind, I emailed him and he was like, you look great, but if you insist, we can touch up those areas under local anesthesia. I was like, oh really? So he was like, yeah, it's a small enough area to where we could just numb it with a numbing agent, fill it with tumescent fluid, and I guess that has like, I don't know, whatever in it. I don't know the complete process, but and then we just do the lipo and you'll be awake and there will be no going to sleep, no waking up, none of that. So I was like, okay, I'm down for that. I mean, sure. So that's what made me decide to do that. And I really didn't want to go back under, you know, general anesthesia, just because I've been under so many times and it just gets scarier and scarier, especially as you get older. You know, I don't know about you guys, but my anxieties lately have been through the roof. So I just think the worst for everything. And so I don't think I would have went back under, I would have never touched my body again if I had to go back under general anesthesia, just because I just didn't want to risk it ever again, really, unless I completely had to, God forbid. So anyways, I was put on the schedule for that, and of course I started looking at myself in the mirror and started nitpicking myself and said, you know what, I kind of have a little bit of fat right here, and you know, since I'm going, why not ask Dr. Altman if he can, you know, tweak up my neck a little bit. So I emailed him and he said, of course, you know, you can do lipo of the neck or chin. I'm sorry, I'm just all over the place. You can do lipo of the neck, chin area under local anesthesia as well, and also do neck Tite. So the same procedure that I had on my arms to basically tighten the skin after liposuction, he could do the same thing on my neck. So once the fat was removed, that I wouldn't have hangy skin, it would be nice and tight. So that is what neck Tite is. You could also Google that, do some research on it, ask your plastic surgeon about it. So yeah, so that was the plan. Now, you guys know I don't like to quote prices just because Plastic surgeons have different prices for different reasons. Just like any business that you run, you have partnerships with people and things like that. I want to be clear that Dr. Altman does not do any of my surgeries for free. This is not for free promo. He doesn't need it. He doesn't need me. He is a board certified plastic surgeon. He's amazing at his craft, and he has a lot of A-list celebrities. So no, I am not sponsored by Dr. Altman. I pay my hard-earned money because I really love him and his team. So the only reason why I kind of quote prices is just because I know you guys want ballpark before you get your hopes set on having this procedure done, and then I say a number, or you go in and they're like $20,000 and you're bummed. So that's the only reason why I really discuss pricing. So for the neck Tite, lipo with neck Tite on the neck or chin area, this area, that can range anywhere from $2,000 to $4,000 depending on what doctor, what area, all those factors. So just think about that. If it's any more than that or extremely more than that, I would think twice. Or if it's $500, I would think twice about that as well. Between $2,000 and $4,000 is what I would recommend you stay in when you're talking to your doctors, just because that's pretty much the pricing that I've seen on my research. Dr. Altman had quoted me $2,500 and he gave me a $500 discount because I am a returning customer, client of his. He takes care of his people. He always treats me amazing, and so I paid $2,000 for that. With the waist area, since I previously had that area worked on for him, it was just a revision. So anytime a doctor goes back and kind of touches on the area that he has done before, it's called a revision. And if your doctor doesn't offer that to you, then maybe you should kind of find a different doctor. And it's not a whole surgery, a brand new surgery over just because you didn't like your results. It has to be some kind of complication. Even with my breast lift that he did, he always checks on the scars and things like that, and I had a little bit of issue with hypertrophic scarring, if you watch my videos before, where the scar was thick and raised, and we did cortisone, aka steroid injections into the scar. So he obviously wants to continue to work with you and help you if you have issues. Just make sure that you communicate with your plastic surgeon and your patient. Obviously they're running a business, they have hundreds of patients, and the one thing that I will say about Dr. Altman is that he is very quick with his responses, and he listens, and he doesn't just dust you off. So definitely make sure you keep an open line of communication with your doctors, because they're not mind readers. If you're unhappy with something, communicate, and see what can be done. Open your mouth, say, hey, you know what, this is bothering me, what can be done, and then go from there. So yeah, that is pricing. And the thing about going under local anesthesia that I want to make clear is that it can be either super expensive or it can be reasonable. And you have to understand that because you're not needing an anesthesiologist. The cost for an anesthesiologist dropped the procedure price, in my opinion. But then I've also seen clinics charging, like, I forgot where I seen it. I seen like a chin lipo for like almost $8,000, and it was a really beautifully done chin lipo, but $8,000. And their reasoning behind it was because since they're not using an anesthesiologist to put you to sleep, they're charging you for the medications that they're using to numb the area. Okay. Anyway, so just make sure you ask a lot of questions about that. So yeah. So I flew to Miami, where Dr. Altman is located. We did my pre-op appointment, a pre-op for local and a pre-op for general, night and day. With general anesthesia, you have to do blood work, you have to do pregnancy tests, you have to do all your consents, which are about maybe 7 to 15 pages long, depending on. It's a really tedious process because you are going to sleep. You have to do, obviously your labs have to go to the clinic. You have to make sure all your numbers are at the right area and levels and things like that. So if you've been through that before, you understand the process. But the process with local anesthesia basically was my pre-op. I went in, signed one document, they gave me my prescription, and I was on my way. I didn't do a pregnancy test. I didn't do any labs, anything like that, because I'm not going to sleep. I'm going to be awake and I'm going to be conscious while having my surgery. So I was kind of like, wow, this was great. Oh, and another huge thing about going under general versus going under local, I could eat. Obviously, you know, before surgery, you can't eat 10 to 12 hours before your procedure because of the anesthesiology, or whatever, that thing, the anesthesia, there we go. You can't eat. So that was one of the biggest things for me. If I couldn't eat the night before and had surgery at 1 o'clock, no offense, I've had that happen to me before, Dr. Altman, and that time he was running late, so it was probably 3 o'clock when I got into surgery and I hadn't ate, you know, it sucks. It's not fun. So this time around, I was able to eat as much as I wanted before, no problems, no complications, because again, you're awake. So that's another big thing. And also I got my medications. They prescribe you when you are doing local anesthesia. They prescribe you with Xanax for your anxiety and to calm you down. Basically, that's your medicine when you're in the procedure, just because you don't want to be anxious, you don't want to be scared, you don't want to be jittery when that procedure is going on. You want to be calm, you want to be out of your head, and you want to trust your doctor. So they prescribed me a couple of Xanax for the procedure. They also prescribed me with a pain medicine, not a pain medicine that was as strong as the one that I had with my traditional liposuction, just something less. And then also they prescribed me with an antibiotic, very, very important, a 5-day antibiotic. Anytime you have surgery, you want to make sure that you are prescribed antibiotics so you don't get an infection, and you want to make sure that you take it from day 1 when your doctor tells you to, all the way as it's prescribed on the bottle, unless you have instructions different from your doctor. I know a lot of people take 3 or 4 when they're prescribed a 5, and you're supposed to do every single dosage that is prescribed to you. And also, hey girl, put your dress down. Oh, anyways, my little one. So what was I saying? Also, you cannot drink when you're on antibiotics. It cancels out the antibiotics. I know a lot of people are like, oh, I'm fine, it's after surgery. No, you cannot drink after surgery when you are on your antibiotics, because it stops the medicine from doing its job. So anyways, next, I went into surgery. I had surgery at, I believe I was scheduled for surgery at 12 o'clock. Yeah?
Where's the salsa?
In the cabinet. So anyways, I was scheduled for surgery. I was scheduled for surgery at 12:30 the next day. I got to the clinic and yes, I'm working, girl. Stop bugging me.
Are you working? That doesn't work.
Yeah, this is working, so stop. Anyways, so I got to the clinic and pretty much went straight in. They had me take one of my Xanax right then and there. We went over a few things, and they had me get into my hairnet, my basically just standard surgical garments, your socks, your dressing, and your bonnet. So nothing crazy, nothing fancy, and we went straight into the operating room. I met with Dr. Altman. We discussed exactly what I was expecting again. I told him I wanted the smallest waist ever, and he kind of just laughed at me because he knows I have no fat on my waist, and I'm kind of at this point just nitpicking. He said he'll go ahead and poke me if I wanted, and we'll see if any fat comes out, you know, and that's just his humor. So he marked the areas where we were going to do the incisions. I had prior incisions from my BBL that were really low in my pelvis area. And he kind of explained we could use those, but to target the area that I wanted precisely, he wanted to create a new incision point, and I agreed to that. I said that's fine. He explained to me that the canal, whatever it's called, is going to be significantly smaller than a traditional liposuction canal. So the incisions are going to be a lot smaller. And then also he closed the incision sites with stitches and took them out himself. So literally it looks like a little scratch. It looks like nothing. The incisions are amazing. So we went in, they cleaned all the areas that I was gonna have lipoed with the Bactine, and mind you, I'm awake, so normally I would be passed out by now with the anesthesiologist. So it was cold, and then since I was doing my neck, they had to clean from the nose down, and I did have makeup on because whatever. So they cleaned from this area down. It gets on your mouth, so I would suggest not to wear makeup, but it wasn't really a huge deal. I didn't realize they would have to clean so far up. So yes, from the nose down to about here. So this area for the neck, and then my waist area, basically my whole stomach and back, they cleaned. I asked them if I could have another Xanax, only because my anxiety at that moment was starting to set in really, really bad. I'm not necessarily a scaredy cat. I kind of have done a lot of very extreme things in my life, and I pretty much have a high tolerance for pain and things like that. But as I said, as I've gotten older, I've been starting to have a really bad anxieties. So I just asked, and they said that was fine. They gave me another one, and then they put a dressing over my eyes just because it just calms. I believe it's very calming. And Dr. Altman asked me if he could put his favorite music on, and I was like, let's go. And he was like, okay. So I'm gonna walk you through step by step. Since I was awake, I was present, I'm a witness to my surgery, exactly what happened, exactly the feelings, the sensations, and the thoughts that were running through my mind. Even though I was 2 Xanax pills in, I still remember this surgery like it was yesterday. So he started on my right waist. He said, can you feel this? I said, no. He said, good, because I just basically touched you with something very sharp. Oh, and I skipped ahead. So once it was time to go, Dr. Altman injected each area that was going to be treated with the numbing fluid. I think it's called tumescent fluid. I'm not exactly sure, but he numbed all the areas with a small needle. I assume it was a small needle because it just felt like a small pinch. It just it just felt like you were getting shots. It just stung, like that really uncomfortable stinging feeling. And you had to get a couple because he had to make sure that he got all around the different areas and nerves to make sure that you were numb. Okay. It's cold in my house. Okay, sorry about that. So where were we at? Oh, when we were doing the numbing. So yep, you just have to sit back, relax while he does the injections for the numbing, and then he basically let it sit for about 10 to 15 minutes so the medicine could do its job and work. And we were ready to go for the liposuction. That's when he did this little poke and said, do you feel that? I couldn't feel anything, and he was like, okay, it's time to start. So we started the liposuction. He made his entry point. I didn't feel anything going in. I didn't feel like a sharp cut. I didn't feel like burning. But as soon as he started the actual sucking, like the suction, not the entry, because mind you, they put the canal in and then they turn on the machine to start sucking and going, all that. When I tell you, it was a feeling that I had never ever felt before, obviously, but I was not expecting it. He has a vibration on his lipo lipo canal. I'm not sure exactly the reason for it. Maybe you can ask your plastic surgeon, but he uses a vibration on it. And when I tell you, when that started going, it just felt like an intense internal body tickling. Like, it was like, I started laughing because it was just like, what the is going on? I was laughing so hard, and Dr. Altman just started laughing back, just because it's like, this girl's crazy. Probably that's what he's probably was thinking. And so yeah, it honestly didn't hurt at all. It just felt, you just felt the movement, you felt the pulsating. It felt like intense tickling on the inside, like somebody was trying to tickle you to death. I will say on the right side hurt. The right side feeling, I don't want to say hurt, the right side feeling was a lot easier than when I got to my left side. The only thing that I remember about my right side was he started to get to an area towards the back where I started feeling like scraping, like scrapes, cuts, something. And he said that was getting to the edges of the area of where the medicine probably didn't get to. Mind you, the numbing medicine can't get to every nook and cranny of your body. So that's why it's great to communicate with your doctor, like, hey, I'm feeling that. So he can kind of be aware of that feeling for you. So that's another good reason why you're awake, you can kind of move and maneuver and get to the areas that you want to get to. But the left side was a whole nother thing. When it got started, it didn't feel like anything crazy, but the area that he was trying to get to was right above my hip bone. So as soon as he got low, I was like, this is too much. It felt like someone was scraping my bone. It hurt really, really bad. It wasn't something where I hopped up and was like, because you're under your Xanax, you're just like, oh my God, this hurts. So I told Dr. Altman, and he stopped. He re-injected me with some more numbing in the area, and we got back to it. It felt better, but I still felt it, and I was like, doctor, let's hurry this up. And he talked me through it. He was like, okay, we're almost done, we're almost there. And I was like, please hurry. He was like, we're almost there, we're done. So that's another thing that I'm grateful for Dr. Altman. He talked me through it because I really, really needed that little extra push to get that little extra, bit of fat out. And he said this is a lot of work for such little fat. So I'm grateful that he did that for me, because it really did bother me. And then we got to the neck area. The neck area, honestly, I thought was going to be the worst area, because it's so close to your face. It's such a little area. And it's like, it seems like it would be such a complicated thing to do. And when I tell you Dr. Altman is so finessed and skilled in this area, it's not even funny. And a little bit of background about my neck fat. So stupid to even say. I've had Kybella done before. One time I've had 2 syringes to get rid of the fat, and I just feel like it looks the same and a little bit more hangy. So I was really disappointed in my results with Kybella. I know they say that you're supposed to do 2 or more sessions of it to see results, but honestly, for the price, the downtime and the pain, it just is not worth it. Kybella is anywhere from $700 to $2,000 per session. Your downtime is anywhere from a week to a month, because you swell up like a bullfrog. You can't leave your house. You look crazy, and it's painful. It burns and it hurts when it's getting done, and then after, it just hurts. So it's just one of those things that I just felt like it wasn't worth it, opposed to the liposuction that Dr. Altman had offered me. He let me know that he was gonna make a little incision point right underneath my chin. I had a scar from childhood when I was maybe 2 or 3, when I had, busted my chin on a end table. So I had a little scar, and he was like, we're just gonna go right in through there and get going. So he had me look all the way up. I leaned all the way up. Mind you, I have a tarp over my eyes, and he just kind of put his hand right here. I know it's a little sexual, but he kind of just put his hand right here, and he started doing the liposuction, I think his hand was kind of guarding and like keeping in control of the skin and the fat and stuff like that. That was one of my biggest concerns, was like, oh my gosh, what if when he's doing this, you know, it pokes through my skin or something? Like, honestly, I was scared. Or like pokes through my windpipe or something. So that didn't happen. Obviously, I didn't feel anything. It felt fine. He was going through, carving through the jawline, over here, getting deep down throughout this area right here. What I would say about the jawline, when they're doing the lipo in the jawline, the feeling that I felt, you could feel it. It feels like it's right underneath your teeth. Like you could feel your teeth kind of rattling. It didn't hurt at all. It felt like it was in my gums, but he was just right under there. And also with the vibration, just kind of getting this jawline snatched. And mind you, it's only been, I believe, 2 weeks. So I'm still swollen. It actually will be 2 weeks tomorrow. So I'm not even at my 2 week part. And so